guys, I'm Jordan. I'm an occupational therapist at Rivers Bend Rehab. I specialize in traumatic brain injury, TBI. So what I focus on primarily is getting my patients as independent as possible, whether that's ADLs or IDLs. It kind of varies, depends on the patient. So if they're a low functioning patient versus being a high level. So for a low level, they're typically dependent on staff, they're 24-hour supervision. So what I'm working on is range of motion, postural stability, trunk mobility, a lot of more manual therapy, like NDT principles, versus a person who is higher functioning. I'm kind of working on those IADLs, community shopping, safety awareness, those higher level skills that they need more independence in. So the variety is huge in TBI as far as what you can do for occupational therapy. You're not really set to one thing. Like say if you're an outpatient and you have carpal tunnel, 9 times out of 10 it's going to be kind of the same protocol. There is really no protocol here. So my biggest thing is finding meaningful occupations for my patients, identifying what they want to do. So for example, my one patient wants to cook, but he has attention deficits, memory deficits, and sequencing deficits. So it's my job to do task analysis to break that down for him, to educate and to teach him the appropriate way to do something. For example, making pancakes. It seems simple, but once you read the directions, looking for the tools or the utensils, setting the environment, safety awareness, turning the oven on, turning it off once you're done, those are all the complex barriers within that task that I need to identify and help my patient be more independent in. So what I'm going to do is I'm going to give you a little tour of like the workspace and maybe show you some things that I do. One more thing as well, besides finding meaningful occupations, I think it's helpful to have activities or tasks that involve the skill that you're trying to elicit. So if you're trying to work on memory or problem solving, there's a lot of resources you can use as far as like crosswords. Lumosity is a great website, and you can use those as an adjunct to your meaningful occupation. For example, you could have that person do a crossword for 5 minutes to get them warm up, work on those problem-solving skills, initiation, etc., and then have them follow with a more meaningful / engaging occupation. So kind of combining those two different approaches to meet your therapeutic goals and outcomes. But I'm going to give you a tour, so let's go. So this is like my main OT treatment room. We have a kitchen, we have a refrigerator, and so for cooking tasks, everything is labeled here for easier access. And so depending on when you're working with the patient, you can either have tasks set up, so you can have stuff out for them, or you can have them look for certain items. So hey, you need to look for the mixing bowl and the spatula, or you can have that all set up. And that kind of depends on the patient and the goals that you're working towards. It's way more difficult having them do everything by themselves. So by breaking it down and providing the equipment for them, it's easier for them to process. And as an OT, or as a future OT, you need to decide on what grading is appropriate for that person. Besides that, we have laundry we can do. We have dish prep and cleaning. And over here we have our fancy dancy OT cabinet. Everything you could ever want as far as like sensory testing, grip strengthening, gait belts, which are huge with all your patients. If they have balance or they're safety risk, you always want to put a gait belt on them and make sure that they're using it. What else? Oh, what I wanted to show you was okay. So this is what I was talking about earlier, like the brain warm ups, brain teasers. I have like a bunch of these. They can really vary from anything. So that's kind of what you're doing, is taking all those activities and skills and incorporating them into their goals. So a patient will demonstrate an increase in strength by 5 pounds, or patient will complete cooking pancakes with minimal assistance or minimal task setup. And so the flexibility here is huge as far as the different occupations we can engage in, and how me as an occupational therapist, how I want to develop that intervention plan. Working with TBI too, I do a lot of vision therapy with scanning, discrimination, closed vision versus far vision. And so these are just simple tools you can either make yourself or download from the internet and have them scan across, have them read certain letters, cover one eye with an eye patch. Over here we have like a wall full of numbers and letters. So you can have the person say, or you can ask them, just read me all the even numbers, read me all the odd numbers, and that's a good way to, one, test their vision, and two, work on those visual skills. Because one thing of TBI is that you see a lot of visual deficits, primarily double vision or a loss of organized scanning patterns. So they have a difficult time going from left to right, up and down. So visually, I do a lot of that. A lot of visual therapy as well. iPads are great as well. There's a lot of activities on there that utilizes visual skills. You can literally have them just read a book, and that was also a good visual therapy as well. It's kind of a specialty area, and you really need to educate yourself and talk to vision doctors to get a better scope of how to do visual therapy. That's another little aspect that I want to talk about too.